Thank you for choosing CARE, Clinics for Abortion and Reproductive Excellence, for your medication abortion services. This video will explain the process. Although it is a lot of information, please remember that everything is written down for you in your handout. Even after you leave the clinic, we are always available to answer your questions and provide you with guidance. The first medication is called mifepristone. It is a single pill that you swallow with some water. This medicine stops the pregnancy from developing and does not really cause any side effects, though you may have some spotting. Mifepristone should be in your body for at least 24 hours and no more than 48 hours before you use the second medication. Please write down the date and time you take mifepristone on your instruction sheet so you know when to begin the second medication. Misoprostol is the second medication you will use. This causes the body to push the pregnancy out, so you will have cramping and bleeding with this medication. You can use misoprostol either vaginally or in the mouth. To use vaginally, place one pill after the other for a total of 4 pills as high in the vagina as they will go, careful not to hurt yourself. To use misoprostol in the mouth, place 4 tablets under the tongue, or place 2 on each side of the lower mouth between your cheeks and gums, where chewing tobacco would go. If used in the mouth, the pills must sit in place for 30 minutes, absorbing into your bloodstream. After 30 minutes, you can drink some water to swish and swallow down whatever is left. Within a few hours of using this medication, the bleeding and cramping will start and last for a few hours, and then it tapers down. You may have light bleeding or spotting over the next week or so, but the heavy bleeding is after using the misoprostol. If you are more than 9 weeks pregnant, you will need to use more than 1 dose as described in the instructions, but please ask if you have questions. About a half hour before you plan to use the misoprostol, eat a light meal, nothing heavy or greasy, so you can take the pain medications that we gave you, Tylenol and ibuprofen. You will also want to take the nausea medicine we gave you, ondansetron, commonly known as Zofran. Please note that if you need to use the nausea medicine before starting the abortion process, you may do so because it is your medicine now. Also, we give you an extra 4 pills of misoprostol for you to set aside just in case you need them. Medication abortion is very safe and over 98% effective. This means that less than 2% of the time there can be complications. One of those complications is what we call failure. That could mean maybe the first medicine doesn't work and the pregnancy continues to develop, or the second medicine doesn't work and the pregnancy isn't pushed out all of the way. Complications may mean that you would need a D and C procedure, dilation and curettage. This is a very common and very safe outpatient procedure, and we would provide that service to you should you need it at no extra cost. By having the extra dose of misoprostol, you may be able to avoid a D and C procedure, but these are uncommon complications. If you ever have questions or concerns, please do not hesitate to call us. We have given you 2 pregnancy tests. Wait 4 weeks and do a pregnancy test. If it is negative, that's great and you are done with the abortion. If it is positive, don't panic. As long as you feel that everything went as expected and you feel fine, then wait 2 more weeks because your body might just need more time to clear out the pregnancy hormone. That's why we give you 2 tests. The second test should be negative, and if it's positive, then please call us. It's important to know that after any pregnancy ends, whether abortion, miscarriage, or even giving birth, you can ovulate again, that is, release another egg, as soon as a few weeks after. That means that you could be fertile before your period starts up again. Please be careful and use abstinence, condoms, birth control, whatever you choose to avoid undesired pregnancy. Also, if you happen to need to go to the hospital or follow up with a different healthcare provider, you do not need to tell them you had an abortion. You are having a miscarriage. Instead of the miscarriage happening spontaneously, it is happening because of medicine. How the miscarriage started is irrelevant to how complications are treated. You do not put your health or your life at risk by not telling your provider about the medication abortion. You are treated the same regardless of how the miscarriage started. Thank you for watching and for choosing CARE. We appreciate and value you, so please contact us if you need anything.